recognizing Her Excellency Prehewot Abebe Gobena, the Minister of Health, the State Minister, Ministry of Health, Federal Democratic Republic of Ethiopia. I don't know whether the two ministers from Comoros are here. I know they're supposed to be having their own meeting tomorrow. His Excellency Lub Yakub Atumane and His Excellency Ahmed Ali Bazi, that is Minister of Health and Minister of Economy, Industry and Investment, respectively, from Comoros. Ms. Zainab Gura, the Deputy PS, Ministry of Health, Kenya. Dr. Loko Abraham Bongasi, the CEO, Rwanda Medical Supply. Dr. Mohammed Ali Mohammed, Ministry, representing the Minister of Health from Djibouti. He's at the PS level. Dr. Leticia Lydia Yasmin, the Permanent Secretary, Ministry of Health, also representing the Minister of Health of Madagascar. Dr. Bernard Valentin, the Permanent Secretary, representing the Ministry of Health, and Ms. Astrid Tamatave, PS, Ministry of Finance and Trade, representing the Minister. Mr. Yosif Barbi, representing the Minister of Health from Eritrea, and Ms. Bibi Rezwana Molabokas from the Permanent Mission to the African Union and ECA Addis Ababa. And all protocols observed. Good morning. I would like to take this opportunity to welcome you on behalf of our Executive Secretary, His Excellency Clever Gatete, who is also the United Nations Under Secretary General. And I would like to start by saying access to safe and affordable healthcare and technologies is not only crucial for saving lives and livelihoods, but is also inherently a basic human right. This high-level meeting to transition the AfCFTA-anchored Pharma initiative in the startup phase of the Africa Pool Procurement Mechanism, APPM, is a significant step towards strengthening Africa's health systems and building resilient economies. Allow me to express my deepest appreciation to the member states and ECA partners, including the AUC, the AfCFTA Secretariat, Africa CDC, AUDA NEPAD, IGAD, the World Health Organization, the United Nations Development Coordination Office, UNIDO, UNICEF, UNFPA, and Joint United Nations Program on HIV and AIDS, that is UNAIDS, for their solidarity and invaluable contribution to the initiative since we started in 2019. Substantive contributions, time commitments, thought leadership, and technical feedback came from the member states' experts and partners. This guidance has provided the much needed buy-in and the impetus for ECA and partners to roll out this Pharma initiative through a responsive co-creation that acknowledges the realities of the continent. Health is a key factor in building a robust and resilient economy. More than just a source of revenue and employment, the health sector functions as a critical support pillar for economic growth and well-being. The productivity and wellness of the African people lies in the availability of medicines to treat diseases when the need arises. Diseases know no boundaries, and it is a matter of health security. On one side, a healthy workforce can provide the economy with the resources it needs for growth and development. Simultaneously, economic growth gives economies and individuals the tools needed to invest in healthcare and well-being. As most of you know, the Pharma initiative from its very launch in 2019, adopted 3 pillars, looking at advancing local manufacturing, promoting full procurement of essential sexual, reproductive, maternal, neonatal, and child health products, and thirdly, to improve quality and regulatory standards on the continent. This is in response to the continent's development deficits in the healthcare sector. It is aimed at supporting the universal health access goals, building resilience in our economies, creating jobs for growing youth population, accelerating industrialization, and also fostering structural transformation in Africa and reducing poverty. In terms of our milestones, we've been able to implement the 3 phases from feasibility studies that identified a business case for pooled procurement of 110 products in participating countries, recommendations of the centralized pooled procurement to the development of pooled procurement mechanism technical design, technical working groups, and in-country stakeholder engagement for ownership and sustained political will. Under the local production pillar, ECA and partners are currently supporting 7 African-based manufacturers after they went through technical and good manufacturing practices inspections assessments to address some of the challenges incurred in producing quality medicines. On quality assurance, under the leadership of Auda NEPAD, we are supporting also the NMRAs and AMA operationalization to guarantee the safety and security of the 1.4 billion people. In the current phase, and this is the 3rd phase, we have worked closely with participating country experts, developing key pool procurement tools, including a data sharing platform that would help facilitate member states in their procurement decision making. Lessons from implementing the Pharma initiative for the past 5 years calls for facilitating and advocating for local production for resilient, inclusive, and sustainable health systems in Africa, where the private sector fills in the gap and contributes to improved health outcomes on the continent. There are investment opportunities in education and training institutions to mitigate shortages of skilled health workers in the health sector, establishing pharmaceutical companies, investment in infrastructure and logistics, finance, and partnerships to include technology transfers and leveraging on the diaspora to fill the gaps. The African Continental Free Trade Area provides a one-stop shop framework to deliver on all of the above from an economic point of view. As the ECA, we also took cognizance of the recent decision of the African Union heads of state and government that vests the mandate for Africa's pool procurement with the Africa CDC, with support of Afreximbank and the Economic Commission for Africa. Consequently, the Pharma initiative, while leveraging on the wide range of opportunities of the AfCFTA and AMA for the healthcare strengthening on the continent, will transition to the startup phase of Africa Pool Procurement Mechanism under the leadership of the Africa CDC. So in this conference, we will deliberate as far and realign our roadmaps for the joint pool procurement mechanism as we also explore the wider context of the pharmaceuticals value chains. We look forward to your perspectives on the technical design, roadmap, and guidance as member states towards the transition of startup of the sexual reproductive maternal neonatal child health in the APPM. I thank you all for being here and also for your continued dedication to building resilient economies, people, and systems. And I wish all of us a very productive conference. Thank you for your attention.